Hi, I'm David Liew from Melbourne, Australia, reporting for Room Now once again from Eular 2023, all here in person, even the poster floor. In here in beautiful sunny Milan, Italy, it is stunning, food's great, people are beautiful, and I feel like a schmuck walking down the street, but nevertheless, it's been a lot of fun. Some great stuff at the conference on the first day of Eular. It's really kicked off with a bang. I want to take you to some stuff from the opening abstract plenary floor. Some really great abstracts here, but what I really want to talk about is actually some registry data from big national registries in Scandinavia, from Denmark, Finland, Norway, Sweden, looking specifically at methotrexate. Now, people speak a lot of smack about methotrexate outside of our specialty about interstitial lung disease. And I think there's still a perception amongst respiratory physicians, amongst pulmonologists, that there's an issue there. So it's really interesting to see these data because we always worry that this is just channeling bias from rheumatoid arthritis exposure. What happens in PSA patients? We haven't really looked very closely in PSA patients on a big scale as to what happens with an interstitial lung disease and methotrexate exposure. These data looked at rheumatoid arthritis in PSA patients who were going to start a biologically targeted synthetic and looked at methotrexate exposure to try and determine whether this was associated with incident interstitial lung disease. We're talking big numbers here, 37,000 rheumatoid arthritis patients, 12,000 psoriatic arthritis patients. In amongst all of that, I can tell you exactly how much the association was between methotrexate and new interstitial lung disease. Once you adjust for disease activity factors, big fat zero. We saw no increased risk. And I think there are some really interesting messages out of this study, and it's really interesting to look at the biologic and targeted synthetic DMARDs overall. And the honest truth is that once you adjust for disease measures, you're not picking out anything in terms of one specific biologic or targeted synthetic being culpable for interstitial lung disease. That's another myth to be busted. But really, methotrexate, we've got to defend it. People are going to talk bad things about one of our best drugs. It's up to us to really defend its use, especially as far as this interstitial lung disease risk is concerned. Risk in inverted commas. For plenty more from Eular 2023, head down to roomnow.com as always. See you there.